Hey guys, Dr. Ina and Dr. Maya here today to talk about continuation of our last week's subject about ketamine. But today we will touch upon ketamine and neuroplasticity of the brain. It's a fancy term that Dr. Maya will evolve into that term. And the next part of our interview or speech will be actually, we're going to be filming the patient who will receive the ketamine IV. And we will be filming what's going to happen during the ketamine. The patient actually gave us the yes to film him. And so we'll film a little bit about before the ketamine, then the intentions that I will talk a little later, during the ketamine, and what's going to happen to the patient after. So whoever is skeptical or non-believer or afraid to see what's happening, you will be observing today during our session. Okay, so let's get back to neuroplasticity. What is neuroplasticity?
Okay, so well, the reason why we connect neuroplasticity with ketamine is that ketamine is really good for inducing neuroplasticity. This is one of the things that they found out about it after so many years of using it as an anesthetic. And why is neuroplasticity important? So for many years, the neurology, neuroscience thought that your brain is static, and what you have is what you have, and that's it. And then after people getting strokes and brain injuries and following up, they realized that actually the brain can develop new nerve connections, no synaptic changes, and sometimes another part will take over, to a limit, of course, the parts that have been damaged by the stroke. When that happened, they realized actually, they came up with the term neuroplasticity, that the brain is not static, because as I said, the understanding was once you're an adult, that's it, this is your brain, there's nothing that can be done, and it's fixed. And when they discovered that there is something that is the mechanism of neuroplasticity, where the brain is responding to changes that happens within and without, and develop new synapses, that made a revolution in our understanding of how the brain works. And one of the things, that the ideas now about how people go through life with the traumas and the tensions and the life is difficult, right? We have anxiety, we have anxiousness, we have stress, we have unpleasant experiences in childhood. It doesn't have to be called trauma, but it's difficult to grow up as a human being, right? It's challenging. Yeah, challenging. And even the child who grew up in the most happy circumstances, life is inherently challenging. And we learn to interact with life in a certain way, and that way we interact with life make the nerve pathways connect in a certain way. So just, to make it clear, for instance, let's say there's a jungle, and there are new settlers who are coming in the jungle, and they will start, cutting through the jungle, cutting the trees and everything to make a path, right? So the first time it's hard, very hard. And then then those people, that group of people, will keep, using the same path, going and coming and going, coming and going. After a while, right, this path will be established. So people who come after, they don't need to work as hard to go through that path. So that's the same principle that happens with the nervous system. If you behave or have a belief in life in a certain way, you started since you were little, and every time in life you re-strengthen that belief, those nerves make like that path. So it becomes like so quick that you go through that mode of thinking. So, for instance, like the belief, life is difficult, and anytime a challenge arises in life, which is inevitably going to happen, what is the nerve track, the road that is ready for you? Life is hard, So what we want with neuroplasticity, which ketamine helps us with, is when you take it, that tract, we can make a new one, which is life is interesting, and I take the challenges as exhilarating, that in a way I can deal with it. So
this is amazing. So the ketamine is the IV that you get maybe once a week or whatever you schedule them for. And that can make a huge difference in the brain neuroplasticity.
yeah, yeah.
That's incredible.
That's why it's important to do two things. So before you go into it, setting the intention is important, right? So we're very lucky to have a patient now who agreed to be on camera, who already prepared an intention. So why is that important? Because you go to the session focused. Your brain, you just need to tell your brain what you need, by the way. It's like a genie. You just need to focus your attention. And so once you have your intention, the session would be an introspective and session that revolves around that. And once the session is over, we have an integrative session where we bring together the experience of it, why the person obviously took the IV ketamine, and the intention that had, and we bring it in a cohesive whole, which allows the brain to develop new paths for a new way of dealing with life.
And the intentions can be any subject you want,
absolutely.
right? So you can make a wish, or you can make an intention, and not only think about it, right, but actually feel it as well.
Exactly.
And the ketamine will open up the heart chakra, and I'm talking about from the alternative standpoint, that it will allow you to feel like it already happened.
Yeah.
And this way, and the universe doesn't know what's present, past, or future, right?
True.
It is what it is.
True.
It's always present.
That
with
is
the universe.
true. Yeah.
So you will talk the language that universe understands.
Yeah.
Yep.
Yeah.
Okay,
Absolutely.
guys. I mean, I think this is incredible. I didn't have ketamine myself. I'm preparing myself to receive one, but I hear so many good things about it, and I hear that people are scared because we are afraid to lose control.
True.
And that control sometimes, or most of the time, is on the way for us to be better or healthier or stronger.
True.
So let's get the patient ready, and then stay tuned, whoever is interested, and we'll try to place as much valuable information as possible for you to decide if the ketamine is the therapy that will be helpful for you. Thanks, guys.
Own journey internally without interruptions or being bothered. And I put obviously blinders so that the light and everything, again, don't bother him, and he goes inward in his journey. So now I'm just putting the music that would be good for him throughout his journey, and it's ready. The nurse, Galina, is preparing. She's gonna place an IV for him. As you can see, she already prepared the fluids.
Give me the iPad again.
Why?
I hear
60 milligrams, like every time.
New
Yeah.
mail, send mail.
So we usually give an antiemetic at the beginning to make sure that he has a good time and calm experience, and then after that we add the ketamine to the fluids. Okay, so Andrew our patient just finished his session. It took from beginning till the end, about 45 minutes. As I'm sure he's gonna tell you himself, it was a very nice experience. It was very safe. At the end, he just woke up, and I think it's important to know, because some people feel worried that they will lose control, or like we've never done drugs, but the truth is, anytime you've done surgery, you're actually done drugs, right? So the point is that this medication is used during surgery, and when you're in surgery, you're completely out, and you actually then don't have any control of what's going on. While the dose that is given with ketamine, you are actually awake. You can stop the process when you want. You can talk. You can get up if you want. You will feel a little bit woozy, but you are in control, and you remember everything that happened, especially if you are not fighting it. You can you can remember the experience, and you can get the most out of it. So our patient did really good, and I think he had a very good successful session. He woke up relaxed and comfortable. We're going to give him about 30 minutes to completely get up and about, and then after that he should be able to talk, and he has his wife who will take him home, because after the ketamine, we recommend that for that day, do not drive. They don't drive themselves, and have a loved one or like an Uber, or arrange for someone to come get them. So I'm very happy with the results of today.